Welcome to the PCOS Fertility Health Podcast. It's Dr. Angela Potter, your host here and the creator of the PCOS Fertility Protocol. I am so excited that you're here today. Buckle your seatbelts because you are about to get some very important steps about your fertility that most doctors aren't talking about. But before we get into it, I just want to acknowledge you for being here. Okay, there's a lot of podcasts out there, and you chose to listen to this one today because you knew that it would give you the answers that you're looking for in order to help improve your chances of getting pregnant. And I think that is just so cool. And you should thank yourself for showing up and continuing to put one foot in front of the other and keep searching out what you're looking for, because that is what true change is. True change is in the little everyday choices that you make, and they all add up so that one day you wake up and you realize how far you've come and how close you are to your dreams. And the reason that I am here with you today is because I believe in your ability to improve your chances of getting pregnant with PCOS. I talk with women all the time who are getting dismissive information like, oh, just lose weight and it'll happen. Or go back on birth control and remember, eat better. People are getting this kind of information, and maybe you are too. And that is why I am so glad that you're here, because that type of fertility perspective is coming from the conveyor belt of fertility care. And I don't subscribe to that kind of care, and I don't see patients respond well to that kind of conveyor belt fertility plan either. But what do I mean? This conveyor belt of fertility care? Well, that's the one size fits all approach. And when a group of people are making a car, one person is taught how to put the door on, and that is what they know. And so when that car structure comes up to them, they put the door on. The car moves forward, that next person puts on the wheels because they know how to put the wheels on. If they switched places, they wouldn't know what to do because they're just streamlined for their job. I'm getting through a head cold today, got a little laryngitis over the weekend, but I am here with you. I've got my tea here, so if I'm sniffling a little bit and you can hear that growl in my voice, I'm working on it, but I am showing up for you. So when doctors are pushing their patients down this conveyor belt of fertility care, they just have a tunnel vision of what that step needs to be. So the most common type of conveyor belt fertility care is with PCOS. You go in and talk to your doctor, and sometimes the first thing they'll say is, okay, well, you got to lose weight. They might put you on some metformin, and then if that doesn't work, then they get you on the ovulation induction medications like letrozole. You might do timed intercourse cycles, and then you're going to move forward and do an IUI. And if that doesn't work, then their only option is to move you forward to IVF. And so this kind of conveyor belt of fertility care, this kind of let's just fit you into a box, it doesn't work well for PCOS. I do not see it working for my patients. And why? Why is that? Well, because PCOS in particular in the world of fertility, it's not going to respond to a one size fits all approach because PCOS is a syndrome. It's made up of a variety of different symptoms that create PCOS. So it shouldn't be expected that just one medication or just one form of treatment is going to open up fertility for everything going on with PCOS. No, your PCOS is going to look different than your friends. And so why should the treatment plan that you get for your fertility be the exact same as your friends? No, you need to step off of that conveyor belt of fertility care and get an individualized plan. Get somebody who's going to take a look at your body to understand what's going on in your unique picture. And that's what helps fertility open up the most with PCOS. And that is exactly why I'm here with you, particularly today, because you are right smack in the middle of this 4-part series covering the PCOS types. There are 4 types. And understanding which type you fall into. Now, you could be 1 type, you could be 2, 3, or 4. It does not matter how many of the types you fall into. It just matters that you figure it out. Because getting this information about what your PCOS type is, that's when you step off of the conveyor belt of fertility care. That is when you harness what is going on in your body. You identify it, and then you address it, and you get a fertility plan that is specific to what's going on in your body. And that is when fertility starts opening up. And think about it. Wouldn't it be wonderful to step off the roller coaster of hormones? Or maybe you're on the other side of it and you're like, I would actually like to have a hormone shift every month. I want to be feeling what my friends are talking about, the irritability and all the hormones happening, because I haven't had a period in a year. But just take a minute to imagine what that would feel like if your body was just working as it was supposed to. You were getting regular periods, you were ovulating, and you were able to make a baby. And that's why I'm here with you. Okay. I am here to share with you the tools and the expert advice that you need in order to move in that direction. Okay. Tiny step after tiny step to get there closer and closer to having your baby. So, we are talking about inflammatory PCOS today. The last 2 weeks, we have covered insulin-resistant PCOS and adrenal PCOS. So if you are a new listener today, welcome. I am so happy to have you here. After you've listened to this episode, I want you to go back and listen to last week's and the weeks before. So then you have this well-rounded idea of what those other PCOS types look like. You can start understanding if they are a part of your picture. And then I want you to show up right here next Wednesday when we cover the 4th PCOS type. And then you'll have that full picture of the 4 PCOS types. So inflammatory PCOS. Inflammatory, it's kind of a vague term. Like, what are we really talking about here? And how can you interpret this in your own body? Well, inflammatory means inflammation. And inflammation in the body is when your immune system is on high alert. And we're going to talk through this. Okay. So stick with me here. You might want to grab, a piece of paper and a pen, or be prepared to write down some notes on your computer, because by the end of this episode, you are going to learn how to identify inflammatory PCOS, understand what signs or symptoms you might be experiencing that would lead you to think you have inflammatory PCOS, what extra tests need to be done in order to get that full picture. Okay. Even if you are folding laundry or at the gym or driving in your car, just bookmark this episode so then you can come back to it and you can really just think through your own health picture, what your doctor has been doing for you so far, and what needs to happen in order to identify if this is one of the PCOS types for you. So this inflammation that's happening in the body, first off, it's important to know that the inflammation doesn't have to be directed specifically at the ovaries or the uterus or, the pelvis, the reproductive center, in order for it to affect fertility. And that's why this is so important, because you've got to put these PCOS pieces together, because fertility is not just about your lady parts. And this inflammatory PCOS is a big piece of that, because we're looking much more wide at the body, more holistically at what's going on in the body and how that is then impacting your fertility and keeping your chances of pregnancy low. So inflammation is when the immune system is on high alert. And your immune system is a lot more complex than you might think, because when we just talk about the immune system, we think colds, as I am dealing with right now, and our ability to stay healthy or get sick when the flu or colds come around. Yes, that's an important part of your immune system, but there's so much more. It's active in your body always, and it is running around being the protector of your beautiful body. And what the immune system is like security guards. It's not like a camera system, not like a security system where you've got a camera at the front door just watching to see what comes in and out or up to the front door and away. No, it is not like a camera security system. It is like security guards. Imagine you are the queen of this amazing country and you have this castle, and around your castle, you have outside the gates these guards, and they are constantly patrolling. You have multiple guards walking around at all times around your gates, around your castle walls, your moat, and they are walking around. They are changing their positions. They are moving in and out when, their session is done, so then they can go sleep and let somebody else take over that can stay on alert. And they are constantly watching for invaders. And if an invader comes up to the castle gates, right, they are signaling an alert. They are saying, alert, alert, I see an invader. They are checking it out first. If they don't know what it is, they are checking it out to see, okay, well, is this perhaps a friend from far off lands that we haven't met yet? Or are you an invader and do we need to keep you out of here? And if it is an invader, then they do everything that they can to keep them out of the castle walls. And if they do find out, oh, gosh, welcome, long lost Uncle Richard the 15th, please come enter, and you have gifts for the queen. Please come in, come in. So imagine that your body is that beautiful castle fortress, and it's your immune system that is those guards that are constantly walking around the castle, constantly on alert, running throughout your body, because that's exactly what is happening. Did you know that you have a huge immune system in your digestive tract? And it is on alert because you eat every day, multiple times a day. And your immune system needs to be checking all that food to make sure that there is no foreign invader. You have immune system cells in every part of an opening of your body. Ears, eyes, down below, all of it. There is a significant part of your immune system there because that is the first point of entry to the body. Those are those guards. But then there's guards running inside the body at all times, making sure that nothing got past that first set of guards that are at the entry. And they're running around constantly making sure that your body stays this wonderful, beautiful, pristine place. And so when something happens that makes the immune system on high alert, that creates inflammation. At the very simplest, let's talk about getting a cut. Okay, you get a paper cut on your finger, and all of a sudden you see redness and it hurts a little bit. That is inflammation, and that is your immune system acting like that to create that protective layer to keep those microbes, those bad microbes, out of that cut and to heal the body. So that's inflammation. You might put a Band-Aid on it, and that helps the guards of your body, the immune system, to do their job. And then after a couple of days, it's done. It's healed. When inflammation is happening inside the body, when the immune system has found something inside that says, alert, 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 we don't see it as easily as we do a cut, and we don't see the healing process. And sometimes because it's happening inside and we don't necessarily know about it, that's what leads to it happening over time and creating this chronic inflammation. And so that's more about what we're talking about when we're talking about inflammation and fertility. It's that internal immune system has been sent on alert to say something's happening here and it's affecting your fertility. So, how does the inflammation affect fertility? Well, there are some important pieces of the baby making process that the immune system could see as a foreign invader. So, let's say you and your husband are getting busy in the bedroom and you're ovulating, you're right in your fertile window. And so you guys are getting busy, and your body, you've got this inflammation going on in the body. And the immune system is going to be like, what is this? What are these swimmers? What? Sperm? This is not a part of our body. We have got to get it out of here. And it creates that alert, alert, alert. Let's get this sperm out of here because we do not like it. It is a foreign invader. And it just pushes it out. Potentially, those sperm get past the guards of the body and it connects with the egg and it implants. Well, then the immune system might go, whoa, what is this new thing inside the uterus? And so it goes, alert, alert, alert. There's something foreign in this uterus. Come on, we've got to get it out of the body because we are already on high alert from inflammation happening somewhere else in the body. We are like, we don't want to deal with anything more foreign. So we have got to push this out of the body, this thing that just got into the uterus. Let's push it out. Okay, leading to early miscarriage. And so those are really the two most important aspects of inflammation and fertility. Not allowing the sperm to connect with the egg, and then not allowing the egg to implant or pushing it out once it does implant. Super important stuff for fertility. Okay, so you do not want to miss this piece. You do not want to be working with a doctor who is only saying, well, just lose weight and everything will happen. Or, okay, the only thing I can give you is letrozole and I'm willing to give you 35 rounds. Let's just keep going because we got to make this work. Oh, you need to be figuring out, is there this inflammation happening in the body? Are there any of the other PCOS types, right? To address that, to then create this fertile, juicy environment in your body to allow for baby making to happen. So inflammation can come from a variety of areas in the body. And I'm going to talk with you about the top places that I see inflammation when I'm working with women with PCOS. And you might be wondering, well, okay, is there a test that I can get done that'll just tell me if there's inflammation going on in the body? There is one test, okay, and it looks at inflammation happening in the body. It is not specific to where that inflammation is coming from, which is the issue. So yes, you have that information that the body is inflamed, the immune system is on high alert, but you need to know where it's coming from in order to really address lowering that inflammation. So let's talk about the 3 top places where inflammation is happening with PCOS. So number 1 is autoimmune conditions. And an autoimmune condition is when the immune system is on high alert and it has decided that something inside the body is foreign and it wants to get it out of there, something that actually should stay there. The most common autoimmune condition that I see is Hashimoto's thyroiditis, which is an autoimmune condition of the thyroid, which sits right here in your neck. If you're not watching on YouTube, I am pointing right to the middle of my neck. And so when Hashimoto's thyroiditis is happening, the immune system is looking at the thyroid, attacking it, saying, I want to get you out of the body, which is crazy, right? Because we all need our thyroids. The thyroid should be just happy hanging out in the body. But the immune system gets confused and it starts attacking that thyroid. Any other autoimmune condition can be happening in the body, creating inflammation. So yes, Hashimoto's thyroiditis is the most common one that I see. But if you have a family history of other autoimmune conditions, then you're going to want to get tested for those and get some important autoimmune markers done. Okay. So you're going to want to talk to your doctor about the autoimmune markers. Talk to your doctor about your history, your family history of autoimmune conditions. Is anything else going on? Let's dive in a little bit to Hashimoto's thyroiditis. I'll need to make a full episode about this, but let's talk about what this means in regards to inflammation, because that inflammation is happening. And so in the medical world, really, when a doctor is testing for thyroid, most often, I would say 9 times out of 10, maybe 8 out of 10 at this point, but they're just testing for your TSH, your main thyroid hormone. And many, many doctors are going off of that one lab value to say, hey, oh, look at that. Your thyroid is beautiful. It's right in this range. Now, hopefully they're reading that TSH level from a fertility perspective, because that range is much tighter than the standard reference range for just the general person. So that's the first thing to look out for. And then the second thing, you can have Hashimoto's and have a normal TSH level. So looking at that TSH level does not actually tell you if you have Hashimoto's. You need to get thyroid antibodies looked at, because you can have a normal TSH and you can have antibodies that are just elevated through the roof. I see this pretty frequently. And the hallmark of Hashimoto's thyroiditis is a TSH, that main thyroid hormone, going up and down. So if someone is looking at your level of TSH and they're saying, oh, this is in a nice, good place, you're all good. Well, next week, it could have skyrocketed high, which are lowering your chances of getting pregnant, because we know how important the thyroid is to talk to the ovaries. So getting a blood test done is just one little blip. What is your TSH in that one moment? So you've got to take that extra step to see, are your antibodies positive? And understand it's also a very simple lab test, and it can be run really easily. And sometimes you need to advocate for yourself in order to get that done. Okay, so autoimmune conditions are one of the top signs that are in your body showing that inflammation is causing issues with your fertility. We talked about Hashimoto's specifically. The second place that I see inflammation coming in a lot is gut issues. Okay, poor gut health. And what does that look like? Well, that is really anything going on in your digestive tract. Okay, you could have bloating, stomach cramping after meals, feeling like, a lead brick is sitting in your stomach after you eat, some heartburn. It could be constipation, diarrhea, both of those, all of the above, anything. And when I'm talking with patients, sometimes this surprises people, because a lot of times if we have symptoms like, say, gas, and then we just think like, oh, this is normal and it's just me. I just, I'm kind of gassy, and particularly after I eat beans or milk, and it's, I've just dealt with this forever. No, actually, your body is meant to digest your foods in a way that doesn't create gas. And so if you are having any digestive issues, that means there's inflammation happening in the digestive tract. And it's probably been happening for a long time, because we eat food multiple times a day. And if there is a small amount of inflammation, that started it, then, day after day, when your body is eating this food and being on more high alert, because it's like, okay, here we go again, more food coming in, we've got to stay on high alert and, keep this inflammation going. So getting dialed in on gut issues is going to be really important. And, is your fertility doctor talking to you about gut health? When we think about fertility, gut issues are not like the most common thing that your mind jumps to. And so that's the importance of taking this holistic picture of what's going on in your body. Because if you're getting, letrozole or ovulation induction medications and no one is talking to you about your gut health, and that's just creating inflammation, leading to your body just pushing that egg out when you're trying to implant it, It's just, you're just going in circles. You're throwing spaghetti at the wall. Taking the time to identify if this is happening in your body and what the cause is of that inflammation and addressing it, it might take a little extra time, but it is going to open up the best chances of getting pregnant. And that's why I'm here with you, because when you have a goal, you share your goal with me. I am here to hold you accountable for your dreams. And so we have got to talk about this stuff. And this is meant to be a sign of hope for you. Because if you are working with a doctor who is dismissing your symptoms, who is only keeping you on that conveyor belt of fertility care, right, you need something else to uncover what's happening in your body that's keeping you from getting pregnant. And that's why this is so powerful. So the third area of inflammation that I see is insulin resistance. Insulin resistance, we talked about that 2 weeks ago. That is one of the PCOS types. And if you have long-term insulin resistance that has gone cared for and it just keeps going on, and your blood sugar levels have not been able to get those back into line, that then creates inflammation in the body. And so the issue with that and fertility right there is, one, we know the connection between elevated insulin and lowered fertility. Because if you remember from that episode, that elevated insulin, it raises testosterone levels. And your testosterone levels, if those are up, that shuts down ovulation. So even before implantation, your body is saying, nope, we are not ready to get pregnant. And so if you're on an ovulation induction medication and you still have this long-standing insulin resistance, well then twofold, it's then creating this inflammation in the body, which is keeping your chances of that egg implanted low. So these are the top 3 areas of inflammation with PCOS. Autoimmune conditions, which is going to be the one that you probably will need extra testing for, because you may not know that you have Hashimoto's, the elevated antibodies, unless you actually test for them. If you have a family history of autoimmune conditions, you're going to want to get that extra testing done to make sure that that's not happening in your body. Gut issues. Gut issues can be identified sometimes pretty easily based on the symptoms that you're experiencing. The symptoms certainly will tell you yes or no if you have a gut health issue that's creating inflammation. But then sometimes you need some extra testing done. And there's stool testing to look at gut health. Sometimes parasites are the issue, leaky gut. Those can be done through stool testing. You can also do breath testing to look at SIBO. Food sensitivities can impact inflammation levels in the body. We'll talk about food sensitivity testing just real quick. I'm going to give you a little pearl of information about that right now. So I don't recommend the functional food sensitivity test, the stool testing, none of that. The gold standard for figuring out if you are sensitive to a food is through an elimination diet. And that's when you take foods out of your diet for at least a month, and then you reintroduce them one by one and see how your body responds. That is the gold standard to understand if your body has a food sensitivity. So that might be a part of understanding if food sensitivity is contributing to your inflammation. If you are sensitive to foods, it doesn't mean you have to avoid them forever. That just means that your gut health needs to become more centered, more balanced in order for you to then digest foods so that they don't create the inflammation. Okay, so autoimmune conditions, gut health issues, and then third is the insulin resistance. And you're going to know if insulin resistance is an issue for you based on some testing or just how you feel during the day. If you skip some meals, if you get really hangry or irritable, if you're skipping meals, then that's a sign that insulin is not balanced throughout the day. You're having big highs and lows of your blood sugar. And that needs to be addressed in order for not only inflammation to come down, but also testosterone levels to come down in order for ovulation to go up. Okay, so we covered a lot today. And now you know the top 3 areas of inflammation happening in the body. You know the importance of addressing that inflammation and figuring out where it's coming from, because how it affects fertility. You know some signs happening in the body that would make you think, I wonder if I do have some inflammation happening in the body. And you know some tests that you might need to ask your doctor about to see what's happening in this bigger picture of your health that's affecting your fertility. Again, bookmark this episode so that you might need to jot some more notes about it and have some firm information about it as well. So do that. If you have a friend who has PCOS and is struggling to get pregnant, send this over to them, because understanding their PCOS type is so often missed. And I don't want it to be what is keeping you or your friend from having your baby. So join me right back here next week. We are talking about the 4th PCOS type, which is post-pill PCOS. And if you are loving this show, please head on over to Apple Podcasts or Spotify to put a positive review, because it means the world to me. And it helps this podcast keep going round, and it helps other people get access to this podcast. So thank you so much in advance. It's really helpful, and I appreciate you so much. And as we wrap up here, I also want to remind you that this podcast is meant for informational purposes only. Okay. It should not replace the medical advice that you're getting from your provider. Now, of course, if you are not getting the type of fertility care that you are looking for, I'm here for you. I have spots open for you to book with me where we'll just talk about your specific situation and what you need to do next in order to open up your fertility. So feel free to book one of those. Link is through the show notes. And I told you this in the beginning, but it is so important that I'm going to tell you this again, that I believe in you. And I believe in your ability to improve your chances of getting pregnant with PCOS. Blessings to you this week. May you go forth empowered and knowing the next steps you need to take in order for your fertility to open up the most. I will see you right back here next week.